would like to get started with some highlights of the HIV epidemic in Vietnam. Substance abuse, particularly opioids, has been the primary driver of the national HIV epidemic. Of 180,000 HIV infected persons by 2010, 70% were among IV drug users. And data from the pretty well-established HIV surveillance system in 2010 conducted in 40 provinces showed that the median HIV prevalence among IV drug users was 19%, while the HIV prevalence in the general population is well below 1%. Other groups of potential importance for the epidemic include female sex workers and men who have sex with men. Opioid abuse has been the major public health problem since the 1990s, with the increasing availability of heroin at low cost, and the number of drug users in the country increased by 70% over the past decade. And at least 170,000 drug users are known to the government. Data from the survey below show that most of the drug users are young and recent injectors, and all of them inject heroin these days. The HIV prevalence in this survey is 23%. The HIV prevention interventions for IV drug users in Vietnam over the past 2 decades include general measures, public education, voluntary HIV counseling and testing, and however, the rate of uptake of HIV testing vary widely, and other interventions include those that are specific to IDU, include the community outreach, peer education, syringe distribution, reported as 27 million syringes distributed last year. And methadone maintenance was initiated 3 years ago, and approximately 3,000 patients are on methadone maintenance at the moment. However, although the HIV prevalence among IV drug users declined over the past 5 years, it is still at a high level. And in a recent report, the HIV incidence is 5% per year, which is high compared to most part of the world in the ITU population. And this data highlight a need for effective HIV prevention interventions for this population. The antiretroviral therapy was generally unavailable before 2003. And the Ministry of Health, with support from external donors, started its rollout program in 2004. And by 2010, 41,500 patients were reported on ART. 60% of them were among IV drug users, and could be considered as an achievement. It should be noted that 65% of these patients are supported by the PEPFAR, and 25% by the Global Fund. And the access to ART vary widely as well. I would like to point out that among 180,000 known HIV infections in the country so far, only 69,000 or 38% in HIV care in Vietnam on the HIV care and ART are delivered by the government. And it shows us that 62% of those who are known HIV infections are not in care. We're conducting a study in Hanoi funded by NIDA, and the study aims to increase the uptake of HIV testing among IV drug users, to expand HIV testing to the social network members of these drug users, and to test an intervention that aims to improve access to ART post-release from drug treatment centers through outreach, and to improve adherence to ART. And to implement this study, we are going to provide a VCT upon release from drug treatment centers, referred those who are HIV positive to services and to follow up in the community. The outcome measures include the uptake of HIV testing, time between release to access to ART, adherence, and biological outcomes. We are currently in the formative phase of the study, and through implementing this study, we plan to provide a VCT to about 2,000 drug users, 1,800 network members, and to provide access to ART to 600 drug users. The challenges for research and programs in Vietnam applying the concept of treatment as prevention include the low uptake of HIV testing in the general population and among the IV drug users as well. Second is the barriers to access to HIV care and ART, and possible barriers include stigma and in some reports, drug trafficking associated with drug use, which may lead to a risk of being arrested. The uncertain future of the ART program in Vietnam after major external aid programs end. And from a broader perspective, it is necessary to build research capacity in Vietnam. And with recent reports of HIV infections associated with injection drug use in commercial sex workers and MSM, there's a need to monitoring the epidemic closely for early detection of emerging risks and for timely response. Thank you very much.